comes to healthcare, you have a choice. Especially if you have some sort of chronic condition, you want to make sure that you do the research and educate yourself to find a primary care physician that is just right for you. I'm at Iora Primary Care Facility here in Phoenix, and this is Dr. Charlotte Gourlay. And Dr. Gourlay is one of the physicians. How many facilities does Iora have?
So Iora Primary Care, we have 5 facilities in the Valley.
Diabetes is very prevalent as we age in the older population.
Correct. And here at Iora Primary Care, as you know, we specialize in patients 65 plus. And why that's important with diabetes is that particular population of patients is at highest risk for developing diabetes. Our approach is very new and it's very different compared to a regular doctor's office. And what I would say one of the biggest values Iora brings is time. We have a lot more time with patients than your typical doctor's office, and we also have a team to provide a holistic approach, and part of that team, which is very key to patient success, is having a personal health coach.
Wow, I really like that, especially if you find yourself alone. And sometimes, it's hard to motivate yourself. Having a personal health coach, wow, that sounds fantastic. What does a health coach do?
Well, what a health coach does is they really build a relationship with the patient. They have time to get to know them on a very personal level, so they can actually get to the bottom of what some of their barriers are, what they need help learning about, and we also really try to focus on resources for them. One is to help them get the lowest cost, most effective medication, provide education, and we really want them to be physically active and what to eat right. So health coaches can spend personal time developing a meal plan, developing an exercise plan, and then they do regular check-ins with them to see how they're doing with meeting their goals.
Accountability will go a long way, huh? With the open enrollment period, now is the time to ask questions and make the all-important decision. Who do you want to be your healthcare provider? This is Steve Stedman. He is the Arizona Sales Director for Humana. And Steve, there is a lot going on right now, a lot of information. It's almost overwhelming. How can we make it simple?
Well, I think the first thing, Terry, is slow down. Right?
Oh.
This is a big decision for people that are on Medicare as we go into 2017. This is their annual election period. And again, I always like to put in, remember folks, it's going to end on December 7th. Very important, because we inevitably run into somebody that forgot and they wake up on 12/8 and go, oh my gosh, what did I just forget, right? So slow down, take your time, talk to some companies, look at provider opportunities. Again, if someone has like a condition like diabetes, let's say, we know if they don't get on top of this, if they don't get it where it needs to be with blood sugars and things like that, it could be a real problem for them. So take your time, maybe talk to some PCPs, some doctors, talk to their care team and see how do they handle this. What's their operation like?
I really like that idea. You actually encourage people to go out there, go to the facility that they're considering, talk to the doctor that they're considering. Why do you find that to be a benefit?
Well, again, some of these chronic conditions as we age, it's just what happens. We can't really kind of play with them, if you know what I mean. We've got to get as well as we possibly can as we continue to age. So again, it's that time of year. If you're really looking back at 2016 and saying, okay, how did my plan work for me this year? Maybe it's time for a new plan. We'd love to sit down with them and talk about Humana. They could one-on-one in their homes. They could come to a sales seminar. But again, let's dive in and look at what's going on, and do we have a plan that might serve your needs better, and maybe a provider that's going to actually do better for you as well.
Do you recommend prioritizing what's important to you before you select a plan?
Absolutely. I think that's real important. Again, how has this year been for me? What's going on? Maybe I've had a really great year, but I just might want a new provider. But maybe again, there's something else going on, and for whatever reason, maybe I'm just not getting the answers or quite the care that I want. So I know right now is my time to maybe pick a new direction, and that's vitally important.
Yeah, because we do have a choice.
We do.
Right,
yeah,
and that's
absolutely.
really important. All right, so now is the time. What's the deadline?
12/7.
12/7.
December 7th.
Yeah, it'll go away or fly by before you even know it. So good information, Steve. Here's more information for you. So to help you find the right care for you and your family, you can contact Humana at 1-800-552-0771, or you can go to humana.com/transforminghealth. And for more information about Iora Primary Care, call 602-223-1876 or visit ioraprimarycare.com.